Please join me in welcoming an awesome leader, the next chair of HFMA, Melinda Hancock.
Thank you. What an honor to be here this morning and to stand on this stage in front of you, my family, and my HFMA family and friends. As I prepared for this moment, I was reminded of John Locke, the 17th century philosopher, who said, "No one's knowledge can go beyond their experience." To me, this means if you want to keep learning, you must keep having new experiences. I know that with every new experience, every step I take going forward, I go beyond to new places, learning new things and expanding my horizons. Today, as I assume the role of chair for this incredible organization, an organization whose members and leaders have given so much to me, I embrace this experience, an experience that affords me the opportunity to give back while continuing to receive. I am committed to lead HFMA beyond its boundaries, to journey with you to new places as we reshape healthcare delivery, to go beyond. And that is the theme that I've chosen for the year ahead, go beyond. I want to share with you this morning what it means to me, how I believe it applies to all of us, and why I think it's important for us as individuals and as an organization to accept this challenge. First, I believe we need to go beyond the boundaries of our traditional roles and responsibilities. Today, more than ever, we are called on as a profession and individually to go beyond our existing knowledge base and skill sets. This challenge takes on an even greater significance as our experiences lead us increasingly from the volume-based system we know to the value-based system that's taking shape. To succeed in a value-based world, we must be open-minded, flexible, and willing to go beyond the responsibilities of our job descriptions. When I have the privilege to advise people starting out in their careers or to talk to business students at my alma mater, the College of William & Mary, I encourage them to never say, "That's not my job." I remind them to never shrink from an opportunity to go beyond their role. I tell them that's the path that I chose, a path that led me to the stage to where I am today, to where I am in my life, to where I am in my career. Like so many of you, turning down a unique assignment is never an option for me. Sometimes the task wasn't even remotely related to my job description. But I knew that taking a risk, going beyond my current scope, would increase my knowledge base, and it always did. I have served meal trays to patient rooms. I've helped start a task force to reduce infant mortality, led media tours for the opening of a new hospital. I've even had my own TV show, Medically Speaking with Melinda Hancock. In many ways, on the largest scale, this is what's happening in our industry and in our profession today. And that brings me to my second point. We are in an industry in the midst of a major transition, one that will require all of us to go beyond the status quo and try something very, very new. The fee-for-service payment system, the foundational financing mechanism for American healthcare, is diminishing. The limits of American system paying for volume is evident to us today. It just hasn't delivered value commensurate to the resources that we've put into it. To paraphrase Albert Einstein, once we accept our limits, we can begin to go beyond them. So while it may not be easy or convenient, we have acknowledged that it's time for a change. And this change is occurring. The Department of Health and Human Services recently sped up this transition to value-based payment models. States and private sectors are also expediting this adoption of value-based payment models. Shortly after the HHS announcement, several large providers and insurers voluntarily formed the Healthcare Transformation Task Force, an industry consortium whose members are committed to moving 75% of their contracts to alternate models by 2020. And the legislation, including the SGR fix that was passed just a couple of months ago, includes payments to incentivize physicians to participate in alternative payment models. and creates a new merit-based incentive payment system for physicians starting in just a few short years. All of these transitions shake up the status quo, go beyond our traditional boundaries, and create new opportunities for us all. As healthcare finance leaders, we're in the epicenter of this change. We find ourselves transitioning into this challenging territory of value-based payments while still living with the day-to-day reality of fee-for-service. In my CFO role 2 years ago, I was fortunate to be in a relatively progressive market and working for a health system that embraced new payment models. The system CFO and I would discuss the changing dynamics of our dashboards and how to integrate the quality and financial aspects of what were becoming the leading indicators for our system. Through it all, we kept working on the financial tools that would enable us to manage the revenue and the volume and the value camps, and how to optimize both. In my current role with DHG Healthcare, I have the unique vantage point to observe a variety of markets in this volume to value journey, and how, like running water, it conforms to the players and conditions of the market. As HHS clearly defines the road ahead, it's not a single payment model, but rather multiple models designed to achieve the triple aim goals: improving the patient experience, improving population health, reducing the per capita cost of care. The road ahead is not a straight line. It's more of an uneven path with all kinds of experiments and multiple models in place simultaneously, calling on us to go beyond our current level of creativity and find new ways to lead the change. My third point today is that we must challenge each other and our teams to go beyond the ways of doing things that have served us well in the past. Our finance and administrative infrastructures were built for an era that is coming to an end. We can't keep doing things the same old way we always have. This includes our use and understanding of the substantial amounts of data that's now before us. We have to be comfortable digging into this mix of clinical and financial data to garner actionable information, to make decisions, and to assess our ability to take on these new payment models. What models should we be in? What are our strengths? What are our gaps? Or said another way, what is our risk capability today? And how do we improve our ability to take on more risk? Data analysis also includes sharing this treasure trove of information. Who needs it and when? Going beyond traditional care models require the optimization of data sharing to ensure appropriate utilization of services, handoffs of care, and discharge disposition. What is the true cost for these longitudinal episodes of care? And how do we negotiate price in this dynamic environment? Success in today's economy also requires new forms of cooperation and collaboration that go beyond our past definitions of partnerships. We've heard about unique ventures with the 3 circles. We all must be prepared to work with new partners, vertically and horizontally, across our healthcare infrastructure. The largest source of healthcare spend is the household. Therefore, what relationships will spring from that collective purchasing power, and how market forces will drive decisions? My 5th challenge this morning is that we go beyond our comfort zones in finance and be a key part of health system redesign. Personally, I've watched dozens of providers led by HFMA members who are already doing this. Clinical and non-clinical members working together to broaden the definition of healthcare outside the hospital walls and into the community. Today, fully 1/4 of Medicare's value-based purchasing program is one metric: spend per beneficiary. Medicare, acting more and more like a private payer, seeking to control the spend across the continuum, and incentivizing every acute care hospital in this country to do the same. Are we accepting the challenge? Just a few years ago, this was not our jobs as finance leaders. In 2007, I was asked by my CFO to help lead our clinical transformation initiative. I had not been involved with clinical initiatives prior to that, And I quickly saw that this new responsibility would go beyond my comfort and control zone. But I also soon realized that how I would gain a comfort level in these new conversations was to learn. And to John Locke's point, to gain knowledge with the experience. And of course, I Googled MRSA, VAP, C. diff. What were they? How did they happen? And why? I even searched for images of pressure ulcers on the internet. Not pleasant. But I wanted to understand the different stages and why that mattered. Why did I go through all this effort? Because I was stepping outside my comfort zone. I was going beyond my defined role as finance director, vice president of finance, CFO. And I wanted to understand, yes, for my job, but also to be conversant with my clinical team members who use this language as a part of their daily work. As healthcare reform took shape and the Affordable Care Act became law, CMS picked up the pace of innovation and my work began to shift again. I had a lot to learn. It was all very new, so I taught myself. I read the Federal Register, and I also found other colleagues, especially through HFMA, who wanted to tackle these emerging models together, and we learned together. These learnings also apply to our teams. We must be sure our teams are not only prepared to support these new payment models, but also soon to lead them. In many instances, this involves innovative methods. When I was at Bon Secours, we set up a 7-week intensive course on healthcare reform. The course was designed to bring members from across the system up to speed and to the next level of understanding. It was my job to lead the change, to go beyond, and to help my teams think differently in the quest to redesign our systems to meet the challenges of this new era. Although I've left Bon Secours in the acute care setting, it's still my job. In fact, it's the job of many of us here today. We also need to think and need to go beyond how we currently think about quality. The financial impact of our quality reporting is increasing. And so is the required transparency, integrity, and credibility of those transmissions. When does our quality reporting need external validation? One example of these type of metrics are the leapfrog indicators, now being included in several commercial contracts. The leadership of Leapfrog decided the time is now for external validation, and I'm proud to be part of the work that's currently underway doing that. What are the next steps in certifying, verifying quality submissions that not only have an increasing financial impact, but are important to be transparent and comparable? We also have to think beyond and go beyond the acute care space. Our health is determined in large part by the care we receive after we leave the hospital and in our life choices that we make every day after that. So we have to understand the care continuum. If you're a provider, put on a payer hat. All episode management programs, shared savings, bundle payments require you to manage care across the continuum. The spending per beneficiary metric requires new thinking, looking at it through the lens of a care purchaser. And understanding the care continuum is a critical key to success. Finally, I want to go back to when Joyce Samowski was national chair. Her theme was beyond the numbers. Joyce stated, we spend a lot of time in the numbers because that's where our day-to-day jobs are. But we need to really go beyond the numbers and foster the strategic thinking needed to take our organizations to the next level. Very well said. We do need to go beyond the numbers as we evolve in this dynamic environment. Joyce recognized this 10 years ago, and we're living it today. Thank you, Joyce. I want to thank Joe and the board for their support, guidance, and friendship along this journey. I am so proud of how we as a board are not afraid to have the conversations that go beyond our comfort zones. I must thank my family, many of whom are here today. They've supported me and my passion for HFMA. I especially want to call out my husband, Jason, who's been a critical partner in this journey, and my 2 children, Lauren and Tyler, who I could not be more proud of as their mom. The best title in the world. My parents are here, Mom, Dad, Susie, as is my brother, who I've always looked up to, even though he's younger, and my aunt, uncle, and cousin. I thank them all for their support and love. My employer, DHD Healthcare, has been incredibly supportive, and I thank you. I appreciate the ideas, the fun, the creativity, the flexibility I've been provided since joining the firm 18 months ago. I close my remarks with a great deal of gratitude for HFMA, its membership, and all the experiences I've gained in my 20-year affiliation. I've learned so much, gone so far, and exceeded my greatest aspirations in large part because of this organization. I recognize what it does and can do for so many of us. I opened this morning with a quote from a 17th century philosopher. So I'll close with one from more modern times, the great Oprah Winfrey, who said, "What God intended for you goes far beyond anything you can imagine." I never imagined I would be here, and I wouldn't be, if not for the vision of many people who had faith in me and offered me support along the way. There's a picture in my office that was given to me by Carrie Cornicelli when I chose my theme for this year. And it says, "Faith is daring the soul to go beyond what the eyes can see." These words are incredibly meaningful to me, and I think relevant to our industry. We must have faith in one another, in our abilities, in our capacity to lead the change, and faith to go beyond our current experience, beyond what our eyes can see. Today, we are asked by our industry, where are your limits, and when do you decide to go beyond them? For me, the answers to these questions are here and now. I hope you will accept my challenge and join me to go beyond, because you are a firework. Thank you. Thank you. Thank you. Thank you.